Hi guys, today I'm going to be going through an athlete case study covering several key components of her strength and conditioning work over the last few months, critiquing her performance of her squat, change of direction and running drill in the context of her skill and capacity to complete each one, and highlight some of my considerations as a practitioner with regards to how we worked on these tasks from a pedagogical, technical perspective. So the athlete is a 21-year-old female footballer who plays in defence. She's currently competing in the Women's Premier League and Bucks Western Division 1A while studying at Solent University in Southampton. In a typical week, she'll compete on Wednesday and Sunday whilst training every day bar Saturday. Injury-wise, she missed the end of the season following a first metatarsal fracture on her left foot and more recently suffered a grade 1 hamstring strain of her right hamstring during her first week of pre-season training back in the beginning of June. I coached her for just under 2 months after her previous coach left the university and before she went home for the summer. Her program to date had focused on maintaining some level of conditioning and fundamental strength, but nothing really beyond bilateral loading, watt bike protocols for conditioning, and some prehab sessions, none of which I had any detail on prior to beginning work with her. So with regards to the focus of our sessions, it was just to prepare her for a full return to training by ensuring she had equal capacity to load unilaterally and perform a max effort sprint without adverse consequence. I did work with her during the academic year in my capacity as a sports scientist and covered a few of her gym sessions, so I had a fair idea of how to work with her in terms of coaching style, which I will attempt to address briefly as a means of providing some context for my initial choice of drills and cues. By far the greatest challenge of this process was learning how to coach this athlete. My go-to method for getting an understanding of an athlete's level of exertion in the initial stages of the coach-athlete relationship is a combination of RPE scale and follow-up questions relating to the movement. The use of RPE scales is widely accepted as an effective way to quickly establish a common language between individuals. Previously, I've asked athletes to rate exercise difficulty from 1 to 10 in conjunction with the effort scale to see if they perceive a relationship between the two variables of difficulty and effort. This time, however, communication was a struggle when it came to getting the athlete to provide any depth or consistency with their feedback. On top of this, she also demonstrates a general dislike for failure of any kind, whether it be a perceived inability to communicate, complete a designated task, or even to coaching. She felt like being given coaching cues meant that she was doing something wrong, rather than a tool for me to adapt the environment as a way to tease out different outcomes and force her to adapt her movement strategy, whether intentional or not. This took significant discussion in the early phases of the coaching process. It's something that I've had to work on quite a lot recently to make sure I'm perceived as supportive rather than overly critical. We know that retention of cues and building buy-in are a result of positive perception of value in the information that is presented and who's presenting it as well as how it's delivered. My experience so far in working with university-age athletes has been implicit trust in the fact that what I'm asking them to do will benefit them in some way. They trust the coach before they know the person, and of course over the time most of us are able to then back up what we do with desired results, whether beneficial for sports performance or not. This could be down to environmental factors. Where students apply for high performance support, there's a certain level of trust in the ability of the practitioners within that environment. And having worked in the same environment since I was a student, it became easy to fall back on the reputation to assume buy-in would be built in a linear fashion. With this athlete, I had to build this up faster, or rather rebuild it, where she felt like my coaching was critical for the sake of it and merely pointing out her flaws rather than offering advice. An initial example of this came during our first week, where I explained that before we could move on to high-speed work, I needed her to be able to demonstrate an ability to perform glute ham raises on both legs without discomfort, among some other things. Her main goal for the season was to become faster, but obviously with so much time out, she hadn't had a chance to work on it and felt she hadn't achieved anything, plus the fact that she hadn't done any strength work for a while. Again, this was during my first week working with her. So we took the time to lay out what I thought at the time was going to be a 3-month plan for the summer to build her back up and start working on this, and to help her celebrate success in small increments. Rather than seeing struggling with a bodyweight task as a failure, seeing an effort as positive, and that attacking it consistently was another piece of the puzzle. As a coach in the past, I've had a habit for turning sessions into seminars where I've over-explained elements in order to demonstrate value. In this instance, however, I tried to get the athlete curious about their aims rather than have me explain it all up front. Furthermore, part of our training structure involved her contributing to the planning of some elements of the session to create a sense of ownership over her pre. Not only did this have a notable effect on her buy-in, But it also helped keep me accountable as a practitioner by making sure I had a reason that could be relayed to the athlete over time. If nothing else, feeding her curiosity was a device for ensuring that there was perceived value in the information and the person who was delivering it. The squat requires no introduction as an exercise. Both it and its derivatives form the backbone of strength programs, both in terms of physical and technical requirements. A successful lift requires sufficient mobility of the thoracic spine, shoulder, hip, knee and ankle, postural and pelvic control, and the ability to balance the load over the lifter's centre of mass throughout the base of support. Previous research has suggested a moderate relationship between squat strength and 20-metre sprint time, as the ability to cope with maximal forces has, to some extent, an element of transfer to sprinting with regards to the production of maximal force. Despite the vastly different demands with regard to time frame and rate of force expression, the whole body demands of a squat do lend itself to sprint performance. Having the athlete aim their hips down towards the floor enables the coach to ensure athletes try to keep their chests tall without using lordosis as compensation, rather than ask for hips back and chest up at the same time. With a full squat, ultimately the aim is to have a controlled eccentric descent whilst bracing the upper back and anterior trunk. Then, once the thighs have broken parallel with the floor, initiate an explosive concentric upward motion by driving the heels into the floor and leading with the chest. An athlete's movement strategy during the lift will be dictated by a combination of factors, most notably the most effective way for them to maintain balance. With an external load placed on the back, novice participants will progress to what they perceive to be an optimal strategy, which can be observed to cause a knock-on effect, starting at the feet and working its way up the connected chain. Common faults in the squat include lumbar lordosis, anterior pelvic tilt, excessive trunk lean, coming up onto the toes, and knee valgus, which I will discuss now and offer some critique for what may cause them to occur and how to attempt to correct them. Starting with the foot, compensations can be the result of limited dorsiflexion. It's common for coaches to cue athletes to have their knees track out over their toes during the squat, but if the athlete is to run out of ankle dorsiflexion range, then there is potential that they will either come up onto their toes in order to achieve sufficient depth. Trunk lean, as mentioned before, can be a means of compensation for a limited dorsiflexion. However, where this is not the case, it is most likely caused related to limited hip flexion as a result of tight glute minimus and medius. This can be assessed by checking an athlete's available internal rotation range, ideally around 40 degrees on each side, and assuming the cause isn't down to anatomical limitation, corrected using a bench stretch or sitting down and passively adducting the femur by pulling the knee across the body towards the opposite shoulder. Where one side may be more restricted than the other, this can lead to the hips shifting laterally as the athlete descends, and it's a result of femoral internal rotation, though not to the extent of noticeable knee valgus. Segueing into knee valgus, not only is this undesirable for maintaining good form in a squat, but the combination of arch collapse in the foot and internal rotation of the femur is associated with the risk of ACL injury. This has been found to be influenced by Q angle, but it can also be related to a lack of active hip abduction during flexion. Cueing this out can be done verbally, or in cases where abductor activity is an issue, by placing a band around the knees in order to provide external feedback. Anterior pelvic tilt, or butt wink, has previously been associated with proximal hamstring tightness. However, it is more likely associated with squat stance. The articulation of the femoral head on the acetabulum can dictate which stance is necessary in order to hit the greatest depth during the squat without imparting some sort of compensation at the lumbar spine. A combination of acetabular retroversion or anteversion and femoral neck inclination can be worked around by widening squat stance or externally rotating the feet in order to minimize anterior pelvic tilt. There can also be a degree of neuromuscular control where it can be attributed to this phenomena, and as such, 6-point rockers or squatting whilst holding onto a door frame can provide a point of reference for athletes to recognize and reaffirm an ideal position for them. Lumbar lordosis can be the result of pelvic tilt, but more commonly as a result of the athlete's inability or lack of understanding to brace their anterior core. Maintaining posture is essential for effective force transmission in order to impart vertical acceleration of the bar, as well as maintaining an effective bar path and minimizing shear force on the lumbar vertebrae. This can be hard to cue out with novice athletes, so typically I'll have them perform a hollow hold or a plank in order to create association between that and the prerequisite trunk stiffness for an effective squat. If not a lack of neuromuscular control, lordosis can also be the result of a trade-off between trying to achieve the necessary squat depth whilst keeping the chest up. In this instance, the best point of reference here is to cue the athlete to keep their ribs down as they descend. External cues get a lot of glory these days, but internal cues can be highly effective for teaching the basics as long as the point of reference is understandable. Last, typical cause of lordosis can be insufficient thoracic extension or glenohumeral external rotation. Lordosis compensates for a lack of mobility necessary to grab the bar appropriately, causing elevation of the ribcage. Both are quite common in running-based sports and require frequent work in order to maintain, as was the case with this athlete. Strategies to impact this are demonstrated later. As part of my practice, I now consistently assess whether a limitation in an athlete's performance can be attributed to a limitation in either the skill or capacity to complete the task. By dichotomizing task execution into an athlete's skill and capacity to complete it, I've been able to organize my cues and drills in a way that can help prioritize my thinking around an athlete's ability to perform a task and consider what may affect in their ability to perform it. Typically, depending on the complexity of the task, a lack of skill can be addressed through manipulation of environmental factors and movement derivatives in order to help the athlete learn. Then, through effective practice and repetition, they can adapt their strategy within the constraints afforded to them by the technical model, their physical capacity, and their athleticism. For example, an athlete who is naturally strong and explosive will see an acute performance increase in their ability to increase loads in the squat with some coaching over an athlete who can perform the task already but lacks the strength to do so at higher loads. Moving on to the athlete at hand, I had her perform a variety of squats in order to assess which one may be most suited to her right now. This assessment unfortunately fell the day after a game, and so her mobility was affected by soreness and tightness already. However, this still helps me assess what restrictions can occur for her as a result of fatigue. Already noticing that her knees don't appear to travel over her toes during any variation of the movement, and her heels come off the ground intermittently as a result of variation in depth, we transitioned to squatting using plates under her heels in order to create artificial plantar flexion. This resulted in greater squat depth, as illustrated by her trunk becoming more parallel, though this appears to be the result of lumbar flexion and kyphosis, potentially due to the heel raise making it easier to balance at the bottom, causing posture to become less of a priority in an unloaded condition. Performing an overhead squat reveals a general lack of thoracic mobility, as demonstrated by the athlete's lack of ability to keep the bar pointed towards the ceiling during the squat. Similarly, her trunk position doesn't seem to improve despite the support provided by the plates. Comparing her performance in the goblet squat, back, overhead and bodyweight squat, both with and without heel support, show a consistent increase in hip flexion with plates under her heels. This appears to be a result of improved balance as her center of pressure shifts from the midfoot towards the heel. Following the squats, she completed a mobility circuit, including a weight-bearing lunge test to establish her ankle range of motion, a few sets of kneeling thoracic stretches, and some angel wings. Her ankle remains consistent with and without support, which, paired with her performance of 10 cm each side during the weight-bearing lunge test, suggests some limitation in ankle dorsiflexion. This may be due to chronic tightness common in football players. However, it can be offset by acute mobility work prior to sessions by focusing on both the calf and tibialis anterior. She's never had a foot injury, allowing increased tibial translation and ultimately ankle dorsiflexion. Though we didn't get footage of this before the athlete left for the summer, we discovered that over the course of a few weeks with this only amounted to a short-term solution, but I recommended its inclusion in a warm-up going forward. Angel wings or wall slides are an effective way to increase or test thoracic extension in isolation. With the lumbar spine pressed into the wall, athlete attempts to keep the wrists and elbows in contact with the wall as best they can, whilst pushing their elbows up towards the ceiling and pulling them down towards the floor. This action requires significant external rotation, as well as the ability to upwardly rotate the scapula. This process requires coordination and activation of the rotator cuff, and this drill is paired with kneeling rotation by having athletes fix their pelvis in position and actively reaching through to reach underneath and behind their opposite elbow to elicit thoracic rotation. By reversing this process and having the athlete hold the cable machine and lean away from it, they create even more rotation as well as scapular translation across the rib cage. We tested her hip mobility by way of a walking C-skip. By having an athlete maintain posture whilst actively flexing the hip and externally rotating her leg as if stepping over a hurdle, it provides a better replication of the demands of those of a squat more than a passive rotation. Not a great image here, but enough to see some degree of deficit, with the athlete asking to take care of her knee abductions. Return to the platform demonstrated that her squat performance didn't improve to the degree that we would have liked after one session performing the drills. We attempted a few repetitions with load, and despite finding them easy, she still needed the plates in order to prevent the bar moving in front of the centre of mass and shifting her balance from the midfoot. It is now that, despite being asked before, she revealed that she had injured her shoulder years ago, and when she competed in rowing, and though she didn't remember the diagnosis, she said that she needed frequent massage to elicit any changes in her mobility. However, when performing a goblet squat, it appeared the anterior loading provided enough of an external cue for her to be able to maintain her balance and posture at the same time, even without heel support. This realization enabled her to intermittently improve her back squat, as it seemed that she learned how to combine balance with sufficient hip flexion and posture. Most players, depending on position, will spend as little as 2% of a match with the ball at their feet. Playing at the back while supporting the midfield requires an exceptional ability for reading and reacting to the game from a tactical perspective, whilst having the physical capacity to respond appropriately through effective and consistent technical execution of repeated accelerations and decelerations from numerous positions. The classic Shepherd and Young deterministic model of an agility task dichotomizes this phenomena into both perceptual, cognitive, and technical physical requirements. I've chosen to focus on the purely predictable elements of the skill in order to gradually expose her to the demands of max speed work, given that her recent hamstring injury occurred within a week of returning to performance. If we break down the physical characteristics of an effective acceleration, the task can be broken down into ankle stiffness, explosive unilateral triple extension of the hip, knee and ankle, contralateral pelvic control, and significant intent. Stiffness is defined as the ability of a body segment to resist deformation and is measured by the peak horizontal ground reaction force divided by the displacement of the centre of mass. While my camera skills have betrayed me and prevent me from measuring this reliably, I can see clearly that on several contacts the heel makes more pronounced contact with the ground, suggesting a decreased ability of the heel to cope with the increased demands of the foot strike, potentially as a result of increased velocity. While the ground contact times appear consistent on both feet, this may be the result of the camera setup and the frame rate rather than her actual ability to tolerate. Ground reaction force. Considering my limited experience in working with female football players, I'm told that running with reduced shoulder flexion extension and elbows flexed is a tactic-related habit. However, we know that arm drive is crucial to overcome the body's inertia in the initial steps of the sprint. Typically, I'd cue this with something like short in the front, long in the back, or hip to lip, but in this case I didn't start to see change until I pointed out that she looked like she was playing the drums rather than running. Franz Bosch talks about attractor and detractor states during the performance of a skill, and so based on my relationship with the athlete, I was able to create a need for a change by making light fun of her technique and creating a need to move towards something different. I've discussed the need for contralateral leg drive and the simultaneous aggressive extension of the stance leg coupled with hip flexion and recovery of the stance leg as a means of maintaining and building momentum, which again I associate with external environmental cues such as drive the floor away and break glass with your knee. Trunk lean is another commonly coached element of an acceleration task, where we understand that keeping the centre of mass low increases horizontal force, but cueing this based on kinematics is a false dichotomy. Trunk lean is a result of sufficient force into the ground behind the centre of mass, which creates forward displacement by increasing horizontal propulsive force. In terms of skill development, and considering the fact that the athlete hadn't performed any field work to assess her tolerance to running-based work, I took a ground-up approach to developing some of the fundamentals associated with the coordination demands of running, as well as the aforementioned stiffness and hip extension demands for effective acceleration. At the summer on-site, Dan showed us his methods for categorizing running drills in relation to their complexity and speed, which I've now shamelessly absorbed and adapted into my own coaching, as seen already with the walking C-skip in the squat section. The aim of the system was to help prioritise the drills which would help develop mobility, bounce, posture, cadence and conditioning, as they relate specifically to the context of running demands. Touching briefly on the coach-athlete side of things again, I explained to the athlete that the purpose here was to allow graded exposure and help improve her skills to increase her tolerance to sprinting in a way that she perhaps hadn't previously. S&C coaches love to abuse MAC drills in field environments, so it was important to explain that these tasks were programmed for their demands, not their ability to make her run pretty. Focusing on pogos for their ability to develop ankle and knee stiffness served as a base for certain warm-ups or in between sets to allow her to practice on quiet days in the gym. I'm still trying to figure out why footballers find running drills so embarrassing with an audience. Next step was to teach bounce and cadence through A-skips. This one took a while at first, so we used to stick with bounds for distance or height and fast alternative contacts for rhythm. After being reminded that A-skip cadence is identical to that of hopscotch, she was able to almost immediately put together a passable A-skip, albeit with some tension around the upper body. Straight leg bounds can be effective for conditioning the hamstrings under stretch, the context most associated with hamstring injuries across sports. Given that she felt tightness around her proximal hamstring during hip hinge drills and straight leg bridges, this type of work seemed like a necessary step to take. Having affectionately named them can-cans herself because of the rhythm, we scaled the output of the drill from low and slow to high and fast, whereby an athlete must drive one leg into the floor, one foot up to the sky, whilst maintaining an upright posture. The key to success here is the reactive leg drive. At first she was just trying to lift her legs up, so we changed the focus to breaking the floor to generate more force in the opposite direction. Finally, a little bit of work looking at her starts. This drill was included as the athlete's request, because as fairly pointed out, she is quite unlikely to begin a sprint from a standing dead start. From a technical standpoint, a 5-meter acceleration of 1.19 seconds isn't terrible, but certainly could be improved upon. When looking closely at the video, the athlete actually uses a plyo step during this test. The strategy has been discussed in research as a way of the athlete utilizing elastic energy to help overcome the body's inertia. However, when compared in controlled research, it has been shown that realistically, its most likely effect comes from a repositioning of the center of mass. Letting the athlete practice this skill whilst ankling and anticipation allows her a more comparable stimulus to that of a game. When comparing her angle of lean, though, there doesn't appear to be much difference between this and her static start. Most importantly, to improve acceleration, athletes need to be given maximal effort in order to develop the relevant neuromuscular excitability and intermuscular coordination associated with high-speed work. Allowing the athlete to pick the start for the drill was a means of maintaining motivation without adding pressure. This will be discussed more in the next section. While the athlete previously demonstrated a lack of capacity to perform a back squat, it appears that her ability to perform a 180-degree change of direction is hindered by her lack of skill. In order to perform a change of direction effectively, athletes must first have the capacity to unilaterally absorb and redistribute large amounts of eccentric braking force whilst rotating the trunk and maintaining effective posture in order to turn and explode off the line. From a technical standpoint, the position out of the turn should closely resemble a static acceleration mechanic, similar to the one observed previously. While eccentric capacity is important, it's important to consider also the context and dynamic correspondence of this biomode to quality. She has previously completed an eccentric protocol and an isokinetic dynamometer at 60 degrees per second, which reveals a 14% deficit in right hamstring strength. However useful as a return to play marker in conjunction with her triple hop scores, it doesn't consider the specificity of the task and its lack of transfer to the biodynamic demands of a change of direction task. The athlete demonstrated the ability to withstand peak eccentric knee flexion torque almost 4 times her body weight during the isokinetic test in isolation. The argument could be made, therefore, that her hamstrings are quote-unquote strong enough to meet the demands of the task. However, going back to the notion of joint stiffness and a limb's ability to withstand deformation, this is a tertiary correspondence at the very most with regards to strength, and even that would be velocity dependent, not to mention the lack of ground impact and the task being single joint versus whole body. Field-based testing is something that previously not been done during her rehabilitation, which is why I've chosen to assess her turning here. Movement skill acquisition and motor learning considers the ways and means by which athletes learn, retain, and reproduce skill performance. SIF states in Super Training that success in sport is a matter of problem solving by selecting the most appropriate solution for a given task in the chaos of an ever-changing environment. And while I'm ad-libbing this definition quite broadly, it does provoke some interesting ideas for how practice can be organised in order to facilitate retention and movement skill actualization within the context of competition. The idea of differential learning, or repetition without repetition, stands in contrast to the idea of a coaching in accordance with an ideal technical model. The complexity of the biodynamical requirements of a movement task mean that whilst appearing kinematically similar, no two repetitions are identical on a kinetic, cognitive, or neuromuscular level. It's common for coaches to erroneously cue athletes into technically, an effective turn can be achieved by minimizing the time spent decelerating. To do this, athletes should use the steps leading into the turn to not only adjust their body, but apply braking force prior to the final step. Paul Comfort's group recently published a study which suggested a strong relationship between superior change of direction time and increased braking force on the penultimate step prior to the change, which makes sense in principle given that greater braking force would mean less force is required to fully decelerate and turn in the final step. Interestingly, the suggestion emerges in contrast to the idea that lots of little steps are necessary to turn well. As well as the steps into the turn, the necessary propulsive force required to re-accelerate can be reduced by leaning back into the turn to place the centre of mass further in front of the point of push-off while simultaneously bringing it lower to the ground. The advantage of this relates to the acceleration cue of taking off like a plane rather than a helicopter. Staying low during the turn results in greater horizontal displacement rather than vertical. Looking back at the example, there may be a tactical advantage to staying tall during a turn if there's an opponent to keep away. So assuming that this could be the reason for the athlete's choice of strategy, the effective coaching of a technical model, the turn could be considered a means to adding to her current toolbox rather than trying to change the model she already adopts for the sake of it. Using a constraints-based approach, I simply set up a turning drill that varies the distance, steps, and stimuli that set up the task, with the athlete knowing that a 180-degree turn was always the outcome. Varying practice too much can have an adverse effect on skill acquisition, so constraints were only adapted once a few consistently successful attempts were completed. As an example of build-up, she started by initiating in her own time and turning how she wanted, followed by a clap start, then a side-by-side race to the line, and finally a head-to-head race. Turning off the line became a cone, which I would move when she wasn't looking, then ask her to turn on a clap. If I needed to break it down more, I could have asked her to perform an acceleration from a sideways or half-kneeling start to allow her to work on the turn without an eccentric component. The side shuffle involves 2 steps forward and 1 step back, formed part of a series of drills that required the athlete to focus on effectively placing her feet around her centre of mass in order to decelerate and accelerate well. This video shows she's more fluid shuffling to her left than to her right, but potentially as a result of fatigue. In the fundamental stages of teaching this drill, we would have covered only a few steps before progressing to this, then throwing a chase, evade, mirror task by placing an opponent opposite her. Over the course of the month that I worked with her, we focused on some of her fundamental movements, including the squat, a plan to change of direction, and linear acceleration mechanics. These tasks formed part of a broader late-stage return to training plan, which sought to assess her ability to perform at high velocity without pain, attempt to improve her skill in performing a basic field-based task, and identified some of her movement idiosyncrasies with a view to ensure that she can perform a fundamental lift by rectifying any limitations in her capacity to perform it. The change in time frame we spent working together, due to my leaving the job and her leaving for summer, placed a substantial limitation on the amount of footage I had to demonstrate the work we did together, but hopefully I've been able to sufficiently demonstrate my understanding of her ability and provide a sound critique with suggestions for improvement. Last I heard, she's still injury-free and now starting consistently for her club whilst building on the programme that I started with her.